Hi everyone, this is NJANA President Jonathan Katz following up on the temporary joint protocol removal. First and foremost, I hope you and your families are doing well during this crisis. As we all know, it is imperative to stay safe and calm as we navigate our way through these uncharted waters of this pandemic. I especially want to thank the many CRNAs who are on the front lines caring for our COVID-19 patients, and those of you who contributed to getting this joint protocol removed during this challenging time. As we all know, New Jersey is one of the most restricted states in the country, so achieving this temporary removal is a huge milestone. However, our work is far from finished. Now, many members have contacted NJANA to learn more about what the removal means for them, so allow me to briefly explain. The joint protocol suspension waives provisions limiting our scope of practice, allowing us to practice fully within the scope of our education, training, licensure, and certification without a collaborating physician. In addition, with the removal of the protocol, APNAs are not required to enter into a joint protocol with a collaborating physician, include the name, address, and telephone number of a collaborating physician on any orders or prescriptions, and review patients or charts with a collaborating physician. Therefore, during this critical time, we as APNAs can function autonomously without supervision within our healthcare environments. Although this is temporary, it is imperative that we stand strong and do our best work during these challenging times to make this removal permanent. In addition, if the protocol remains lifted, it means you will have increased autonomy at all of your locations, allowing you to practice to the top of your license and accordingly negotiate higher rates for your highly desired services. As we continue to move forward during these difficult times, NJANA and I, as your president, will keep you updated along the way. I will now forward the message over to Blanck, our legislative director, who will discuss the current environment in the New Jersey medical facilities and what we can do to ensure this removal remains permanent. Again, stay safe and thank you. Thank you for your support.
Thank you, Mr. President. I'll be respectful of everybody's time, so I'm going to jump right in. Clearly, the specifics and the details surrounding this executive order removing restrictions on your license as an APN in New Jersey, as a CRNA, have led to some anxieties and some role confusion, and even more disturbing, of course, have led to those that don't have our best interest in mind trying to massage, manipulate, or otherwise misinterpret the language in the executive order to be able to use us to their benefit rather than to the benefit of the system overall. So, look, essentially this, everybody needs to understand that when, this whole thing was being developed, the state association was, speaking directly to, the Department of Health, the State Nurses Association, various other stakeholder entities, the governor's office, etc. So, when I tell you that NJANA very thoroughly understands in an intimate way the idea and the intention behind this executive order as well as the language in it, you can be absolutely assured that that is the case. So let's just say this, right? There's been some, misinterpretations that this is location specific and that, the restrictions on your license are only waived, the joint protocol is only waived when you're working in an operating room. I mean, quite frankly, and point blank, it's just bull. You're an advanced practice nurse in New Jersey, and this executive order was predicated on a couple of things that have nothing to do with the location in which you practice. So let's break that down for just a few seconds, and maybe you'll be able to glean a little more insight into where this is going, and then I'm going to offer you some strategies for ways that you can pursue this conversation and tell you what the State Association is continuing to do to pursue this conversation. So that being said, the executive order was predicated on the belief and understanding that giving, the extenuating circumstances that are before us, the likelihood of continuous physician supervision over providers such as advanced practice nurses and physician's assistants is highly unlikely. And so the evidence was carefully weighed as to whether or not that was something that needed to be preserved in order for us to save lives and to continue providing urgent or these essential services. And the governor's office was very clear in that for those provider types that have demonstrated an education level, a safety standard, a dependability in their licensure, such that they don't need physician supervision during these times. Your license is unrestricted at this point. And for us, that includes removal of the joint protocol. And again, that's regardless of practice environment. So if you've demonstrated the education, which APNs have, if you have a proven safety record in New Jersey, and given the likelihood that continuous physician supervision is not going to be a reality as this thing unfolds, it's understood that you need to do what you know how to do in order to save lives, prevent injury, preserve life, etc. So don't let anybody else, physician or otherwise, tell you anything other than that. And if they have any questions or concerns about how that executive order should be interpreted, they know full right well that they can call the Department of Health, the Commissioner Judy Persicelli's office, or they can call the governor's office, his policy shop. They know how to get in touch with all these people. Hospitals in New Jersey are one of the largest economic engines of the state. So believe me, they know how to get in touch with this. What is probably occurring is that physician representatives from your anesthesia department are playing a middle role between the hospital administration and the nursing, nurse anesthesia workforce, and they're, basically trying to explain to the hospital how this should be interpreted. So to that end, the state association, in response to comments, concerns, questions raised by the membership, will put out, a response, a letter, otherwise to the hospital association and all the hospital CEOs and CNOs, explaining to them, the way that this is to be interpreted, and again, directing them back to the governor's office in the event that they have any questions. Keep this in mind. Let me say this a little bit further, right? So there's the COVID crisis, and the ability to utilize your skills and education as an APN to help manage that. Now let's be a little more forward thinking, and let's talk for a second about the world after the COVID crisis, has moved on. There are a lot of essential services out there, like vascular access centers for patients, requiring dialysis treatments and need access, or women's health services. And those services are typically provided in ambulatory surgery centers that may only operate 1 or 2 days a week. Now, many of you are familiar with this idea of being a 1099, what they're calling the gig economy in the state. And so the way that, the idiotic way that the joint protocol was applied and regulated in the state of New Jersey basically says in facilities under the purview of the Department of Health, a physician anesthesiologist needs to be present in the building when you do what you do as a CRNA, APN anesthesia in Jersey. And so in saying that, right, these facilities where 3 and 4, maybe even 5 facilities, anesthesia services, are administered and covered by one anesthesiologist going, a different day each week to each of these 5 centers. None of them are going to be able to provide those essential services should that physician anesthesiologist that's been covering them become infirmed or worse as a result, or even displaced, workforce-wise, as a result of the COVID-19 crisis. So if you understand that, then you're starting to glean how throwing out this joint protocol and recognizing your expertise, education, and training, should you choose to practice at that level, is incredibly valuable to providing access to essential healthcare services in this state to its patients, both during the COVID-19 crisis and the pandemic, as well as, after this has passed on. And we're all trying to return to, what will be the new normal, right? So to that end, the State Association will continue to communicate with, lawmakers, policymakers, but most importantly, with colleagues like you. So for those of you up in the northern part of the state, I understand things, devolving into chaos, and, you're feeling the full effects of why you need to be permitted to practice, in an APN role. Why you need to be able to oversee the care of multiple patients at the same time, in conjunction with your critical care nursing colleagues, physicians, etc. Right? And to those of us in the southern part of the state, where the situation has not um, advanced to that level, but yet, you're already starting to hear under rumblings of North Jersey shipping you patients because they're overloaded up there. It will not be long before you find yourself in that situation as well. Everybody needs to understand that the rule book is out the window. And we were already experiencing workforce shortages at regular levels of acuity, and this is a whole nother situation. So, I applaud those of you that feel comfortable, that step into that role. I can tell you through the resources that have been assembled through NJANA, should you be on the fence, you have access to, what you need to be able to make decisions. Nurses know what they don't know, and they know who to go to and how to get help, and we're certainly nurses. So if the system, and the patients, need you to practice at that level, and you want to step in, we've got the resources that you need. And you can access all that stuff. If you haven't seen the newsletter, go to www.njana.com. Make sure your email and your information is correct. We're doing things like Wellness Wednesday, offer strategies to help you de-stress and cope with the anxieties that a lot of us are facing, in light of this crisis. We're also sending out clinical resources, the most up-to-date current clinical resources on a semi-weekly basis so that you have access to what you need. Your president has offered his email address. We're doing our best to answer your direct comments on Facebook, either privately or to put out, more generalized statements that kind of answer many of your questions, in one shot. So please continue to stay in communication with us. Please continue to stay safe. And I'm sure you can expect more videos like this from the president and from myself, explaining the nuances of what's happening to your practice, and explaining to you how we're helping, and imploring that you stay in contact with us so that we can continue to be as effective as possible to ensure your safety. So thank you very much. Stay well, and you'll hear more from us shortly.